Hi, I'm Dr. Michael Craig with Dr. Spine in Indira Nagar in Bangalore. And I'm here with Rebecca. She's a new patient, and we're going to get started with an adjustment. What I'm going to do is do a little bit of explanation. This is what I do with all new patients when they come in. I explain a little bit about chiropractic, and I go ahead and get started with them. Look at the x-rays. Whatever I find, I go over that with them, and then we go ahead and I do a leg check, do a spinal exam before I get started, and then I adjust whatever segments are needed to be adjusted during this visit. After that, I can tell you whether or not chiropractic will be of benefit to you, see how your body responds to that adjustment, and then based on the response that your body has, then I can go ahead and set up a plan for you where I can see you more than one time usually. Chiropractic adjustments are very powerful. However, most of the time results take longer than one visit. So just be aware when you come to a chiropractor, there's probably going to be a series of visits that you'll need to come in because the body, even though we can relieve pain right away, sometimes it takes the body time to readapt to feeling good and to being in alignment. So with that in mind, tell me what's going on. Rebecca, what's the problem?
I have severe back pain, sir, since 1 week.
Okay, so it's been the low back.
Low back, sir.
Right back in here.
Yes.
Okay. Is there any radiating pain down into the buttocks or the legs or anything, or is it just local pain, local low back?
Local back pain, sir.
Okay. So what I'm going to do, Rebecca, is I'm going to put you on the table, have you lie face down, and I'm going to do a spinal examination, find out where the pain is, and then we'll get started from there, okay? I'll also do a leg check to find out how the hips are balanced, because what I like to do is work from the bottom up. And then when I do that, we get the best results, okay? We've already gone over your x-rays, so we find there's nothing abnormal about your x-rays, and it should be a fairly quick fix. However, I just need to check, find out for each visit, okay? So let's have you lie face down. And what we do is just put your nose right in there. Put your arms to the side. So what I'm going to do here is move the microphone over because it gets in the way. There we go. All right, so I'm doing a leg check now. This tells me whether or not the hips are balanced, and right now her legs are balanced, which means that she doesn't have a rotated hip. So the hips are fine. Sometimes there's a rotation of the hip back. Usually this rotates back, this rotates forward, in which case I would do a special adjustment. With her, I don't have anything to correct on the hip itself. The sacrum seems to be in alignment. So we know the problem is not in the hip or the sacrum, it's in the low back itself. So there's a very important move that I use. And what I have you do, Rebecca, is lie on your side and face me. Can you do that for me? So just face me, bend this knee up. Straighten this bottom leg out and put this arm right here. This is called a side posture adjustment, and what it does is it just basically exercises the low back, exercises the back, stretches it out, allows for the interference from the low back to be removed, allows the spine more flexibility and pressure to be taken off the spine. Okay, just relax. Okay, so you hear that little popping sound? That's just a release of the spine. Excuse me. We're correcting what are called subluxations, which means we're taking the pressure off the spine, off the nerve roots, which will allow the spine to be more flexible, take pressure off the spinal cord, off the nerve roots, give you more relief, okay? Let's have you turn over on the other side, face that way. And we essentially do the same thing from this side. Let's have you put your face that way and just relax for me. Okay. Is that okay?
Yes, sir. Fine.
Okay, good. All right, turn on your back. Lie on your back now. So we corrected the low back problem. Usually what I like to do from then is I like to work up, which I'll also do the mid back, and then I like to check the neck out because the whole spine is involved. Usually not just one segment, it's usually several segments in the spine. So I'm going to go over here and put this arm right here, and I'm correcting what are called anterior thoracics, which means sometimes the bones in the mid-thoracic spine get jammed up into the rib cage. I'm sort of allowing that pressure to be removed, okay? So take a deep breath, blow it out. Okay, again, deep breath, blow it out. And one more time, blow it out. Okay, is that okay?
Fine, sir.
Is that good?
Yeah.
Okay. And now I'm checking the neck. What I do is I usually palpate. She didn't have a neck problem. She didn't have a cervical problem, but I like to check the neck just to make sure everything is in order. And her neck is moving very well, so I may not need to adjust this. But there's a little fixation right in there. You feel that? Feel that? You don't feel
No.
much. Anyway, I'm going to go ahead and correct that. It's a very simple move, like that. Okay? Did that hurt?
No, sir.
No. So that's a cervical adjustment. Right now her spine is in perfect alignment. Sit up for me,
Yeah, sure.
Rebecca. How do you feel?
Fine, sir.
Is it feeling okay?
No.
So stand up, walk a little bit. Tell me how your low back is doing. Okay.
Yeah, fine,
Go ahead and have a seat again. So how's your back now?
sir. Okay, sir.
Okay? And what I usually do, she's a brand new patient. She only had a very small problem, so I'm not going to recommend a lot of visits for her, maybe a few. But normally, what I would recommend in cases like hers would be probably around 6 visits, 6 to 10 visits. And then that way we allow the spine to get corrected, and then it's going to go back because the spine wants to go back to its old habits. I mean, it has habits. They're physical habits that the spine has. So you just come back after a few days, I recorrect it, then it goes out again, come back, recorrect it. So that's how chiropractic works, usually. They're called spinal misalignments or subluxation. Subluxation means a misalignment with nerve interference. Chiropractors remove subluxations. That's our main job. And indirectly, and hopefully, we also relieve pain. Sometimes pain comes back though. So with regular chiropractic adjustments, you're going to feel much better and have no problem. Any questions? Okay. So thank you for joining us at Dr. Spine. Please come see us for a chiropractic checkup and look forward to meeting you.